Right. So if you have read and understood considering a critical care scenario, kindly tell me how would you manage this patient now?
I will manage according to the prescribed call using ABCD approach, check the airway, breathing and circulation assessment, the pulse and the blood pressure. As the patient is dehydrated, I will give 1 liter of normal saline and then assess. So patient most likely I need IV hydrocortisone. I will give 100 milligram followed by 200 milligram over 24 hours. I'll start assess the GCS and expose the patient. Then I will run some investigation, routine investigation on the urea or the chloride. Then I'll make according to the cost.
Right. Can you please comment on the patient's lab? Patient has presented with hypernatremia and hyperkalemia, and the random cortisol level being 2 nanomole per liter. How would you manage that?
This patient might have Edisonian crisis. I will give IV hydrocortisone 100 milligram followed by 200 milligram over 24 hours.
Okay. Why has it occurred?
Patient might have stopped using steroids suddenly.
I can hardly hear you. Can you please speak up? What did you say? Why has it occurred? Something with steroid.
Because most likely patient has withdrawn steroid suddenly.
Okay, withdrawn steroid suddenly. Yes, correct. Can you define the term steroid?
Steroid is a chemical compound, have some characteristic arrangement, contain 4 cycloalkyne rings that unite to form together.
Okay. This steroid, can it be synthesized endogenously?
Yes.
How? Can you please explain?
It is synthesized in the adrenal cortex from the zona fasciculata.
Yes, as in? Can you?
In the zona fasciculata.
Yes. It secretes what? What is the name
cortisol.
Of cortisol? Okay. What are the actions or mode of action of cortisol? Can you please tell me?
Cortisol has the anti-insulin effect that increases the blood glucose level and also induces gluconeogenesis, and also has anti-inflammatory effect, and also induce protein synthesis in the liver, and also act as immunosuppressive agent, and
yes.
also act as metabolic control such as aldosterone, and also it will increase the blood pressure.
Yes. Right. Can you please tell me how this cortisol acts, the mechanism of action?
It acts in many systems.
Yes.
In cardiovascular, increase blood pressure.
Yes. If you can tell me the cycle, how it begins, how a person taking steroid gets notified by what signals or what, if you can tell me.
Patient might have nausea and vomiting and present with anexiolytic shock. And also there's
yes.
metabolic disturbance.
What I wanted to know, like how hypothalamus sends signals to where? Corticotropin releasing hormones to anterior pituitary.
Yes, in the hypothalamus, it releases corticotropin releasing hormone. Then it goes through the pituitary, mainly the anterior pituitary gland, where it secretes adrenocorticotropic hormone.
Yes.
Then it goes to the adrenal cortex, it releases cortisol.
How the negative feedback effect occurs?
It is acted through the hypothalamus and the pituitary gland through the negative feedback. If there is high level of circulating cortisol, then it leads to decrease the level of corticotropic releasing hormone.
Okay, good. Can you please tell me what is Cushing syndrome?
Cushing syndrome is a metabolic disease which is characterized by high level of circulating cortisol. Patient presents with many symptoms like buffalo hump and Cushing truncal opacity, and also have hirsutism and straight abdomen, and also patient might have high blood pressure.
How Cushing syndrome is different from Cushing reflex? What is Cushing reflex?
I will go back to it.
Okay, can you mention how this steroid, how it affects different organs? You were telling me about those different cardiovascular system. How would it affect?
Yes, this glucocorticoid is acts on CNS, induce mood or behavior change.
Yes.
Also acts on the skin, it reduces thinning and atrophy of the skin. And also it acts in cardiovascular, it increases the blood pressure, and also in the bone, the inhibition of the collagen synthesis by fiber.
Yes.
And
how it affects kidneys?
The respiratory is
yes.
The respiratory is stabilize the mast cell and prevent bronchospasm.
Okay. What should be the management? How can this be prevented that patient will not have Edisonian crisis?
Patient first should tell the doctor if he is using steroid.
Yes.
Wearing steroid card or the steroid medical alert checklist. And also I will shift to IV hydrocortisone and increase the dose of steroid.
If patient is already taking steroids and a patient has to undergo surgery, who is the most responsible person should be involved or informed about patient taking steroid?
The endocrinologist and the anesthetist.
Anesthetic, basically. Endocrinologist is already taking care. Okay, can you tell me what is Cushing syndrome? Oh, you just told me. What are the complications that can arise for a patient who has Cushing syndrome?
For patient going to surgery, it's most likely to have high blood pressure, which can cause bleeding during surgery.
Yes.
And also patient might have symptoms, nausea and vomiting.
Yes. Okay, what measures can we, if you can tell me, what are the types of Edisonian crisis?
It can be primary or secondary.
Yes.
Primary such as Edison's with inadequate adrenal supply of cortisol, or
yes.
can be secondary due to trauma, infection, and surgery, and sudden withdrawal of the cortisol.
Good. Thank you.
Thank you.